Namaste. Let's take up two case studies together today. A male patient aged 22 years and of Vata-Pittala Prakriti had developed severe Admana, Kharamala Pravritti with severe Krichrata, Guda Shola, Udgara Bahulya, Shira Shola, Netra Daha, Shola in Vama Amsa Pradesha, that is left scapular region, and Shola in Vama Hanu Pradesha, that is left jawline, since 3 days, following excess intake of dishes of bitter gourd. The second case, a female aged 19 years and of Vata Kafala Prakriti had developed severe Shola in Prishta and Parshva, Shola Yukta Alpalpa Krichra Mutra Pravritti, Angamarda, Shira Shola, Admana, Pratishyaya with Tanusrava, and Agni Mandya after she went for a trek continuously for 5 days to a Rukshoshna Pradesha. Note, patient had taken abdominopelvic USG on her own before consultation for these symptoms, and that had revealed cystitis. So what shall we diagnose these conditions as? Should it be grossly diagnosed as cases of Vata Prakopa? No. The diagnosis of precision in both these cases is Udaavarta. That is, both these cases were the cases of Udaavarta with different signs and symptoms. To have a quick review of Udaavarta as described in Charaka Chikitsa 26th Adhyaya 10th Shloka, which says, excess sevana of kashaya tikta katu ushna ahara, vega sandharana, abhojana, maithuna, etc. vatakara nidanas will lead to apana vata prakopa in pakvashaya and avarodha of adogami srotas of sharira along with vit mutra maruta sangha, which eventually causes the kupita vata to move towards urdhva sharira, which is termed as Udaavarta. The signs and symptoms of which are Ruk in Basti, Kukshi, Udara, Prishta Parshva, Admana, Hrillasa, Varcha Apravritti, Basti Shotha, Pratishyaya, Kasa, Jwara, Mutra Krichra, Shirobhitapa, and many other Anilotha rogas. It is very clear from the review of Nidana and Lakshanas of Udaavarta that both the priorly presented cases had the combinations of the symptoms and signs of Udaavarta alone. While the Nidana of Udaavarta in first case was Atisevana of Tiktarasa, Nidana of Udaavarta in second case was Ati Vyayama or Sahasa. So, as both these cases were precisely diagnosed as cases of Udaavarta, they were successfully treated by administration of Udaavarta Hara Chikitsa Sutra as advocated by Acharya Charaka, that is Anulomana. While the first case was successfully treated by administration of Sadhyo Virechana with Brihat Saindavadi Eranda Taila, second case was successfully treated with administration of Abhyantara Snehana with Sukumaragrita and Bahya Snehana with Kshira Bala Taila until proper Anulomana had appeared. So, the noteworthy implications from these cases are: number one, Ayurvedic diagnosis with precision is imperative to have an accurate Ayurvedic treatment plan. For example, as the priorly told cases were precisely diagnosed as cases of Udaavarta, accurate treatment plan, that is Anulomana, was administered and it was quickly and successfully managed. Instead, if it was diagnosed as Vata Prakopa grossly, one would end up in prescribing Vatahara Kashayas, Sholahara Gugulu Kalpanas, etc., which would not absolutely address the underlying Samprakti. Implication number 2. Udaavarta is a pathological event which has no equivalent in Western medical science. So, diagnosing such cases of Udaavarta on parameters of Western medical science might mislead. Thank you. We'll get back to you with another new case study.